Hey, what's up guys? My name is Chin. I'm a physical therapist, and in today's video we're going to discuss how to best manage pain and symptoms associated with knee osteoarthritis. We're going to try to answer this very question here: can anything be done for osteoarthritis of the knee? So let's start by diving deep into what osteoarthritis really is. And that is a condition related to the degeneration or wear and tear of the joints. Your joints tend to wear and tear over the years because we put load on it throughout our life, right? And so specifically the cartilage of the bone, which is the protective tissue at the ends of the bone, wears down gradually over time. And because of that repetitive stress and repetitive loading on those cartilages, the bone causes inflammation. That could be due to bone-on-bone rubbing and grinding, and so that inflammation eventually causes pain signals around the joint, and that pain signal gets sent to our brain, and our brain picks up on that, saying, hey, there's something going on in this joint. So if you take a look at these pictures here at the bottom, you can see a healthy knee joint and a knee joint with some wear and tear over the years. The knee with the osteoarthritis, you can see that there has been some degeneration in both the picture on the left and picture on the right. I do want to mention that osteoarthritis is a normal part of aging, and it's just a matter of how we want to manage it and how we want to decrease pain going forward, because we can't prevent degeneration of the joints. So going on to the next slide here, I know that the pain that comes with osteoarthritis can be painful. These are some of the very common ways that the patients that I treat and I work with describe their pain. It's a dull, achy pain in the knee that is constant. It doesn't get relieved. It's also a sharp pain in the front of the knee when you're loading the knee, meaning when you're putting weight on that knee with activities like going down the stairs or walking, or when you're having to stand up after sitting down for a while. That's when you put the most amount of loading or weight on your knee, and so that's when it hurts the most. You can also have some stiffness in the morning. The knee doesn't feel like bending and straightening like it used to. So that's all part of osteoarthritis. And here's a good image describing everything or every symptoms that you may feel associated with knee osteoarthritis. So pain with activity, like we mentioned, limited range of motion, that's stiffness, joint swelling. You could see some swelling because of the inflammation. Knee tenderness, when you press on your kneecap or muscles surrounding that kneecap, it feels tender. Feeling like the knee may give out, and the deformity of the joint. You're not going to be able to see the deformity, but that's how it feels. So what do we do now? What are some treatment options? The first one is physical therapy. We'll go into a more detailed explanation of these three things, but I do think these are the most important grounds to cover when it comes to physical therapy and working with knee OA patients, knee osteoarthritis patients. So doing the stabilization and strengthening exercises for the knee, patient education, and learning your options going forward. What do you want to do in terms of how to manage pain and how to treat the knee going forward? And then we have the neuromuscular re-education, kind of retraining your mechanics of the hip, the back, the knee, and the ankle to make sure that we don't put so much loading on those knees that have gone through a lot. And then there's also the total knee replacement surgery, which is also another valid option. We do see patients after this specific surgery in physical therapy, but this is also one option to completely just remove that knee joint and replace it with an artificial joint. It seems to have good outcomes, especially if you follow up with PT. So that's one option there as well. It's definitely more expensive and less conservative than physical therapy, but it's commonly done. So you can take a look at the resources out there if you're interested in total knee replacement surgery. And then you also have the cortisone injection. The cortisone essentially is an anti-inflammatory medication that gets injected into your joint to try to calm down that inflammation that's happening in the joint. And so I don't recommend doing this repetitively. It's a good temporary pain relief, but once you start to do it over and over again, it might cause some erosion in that knee joint. And so you don't want to rely on this as a permanent solution. But for temporary pain relief, it's certainly an option. And you also have the PRP injection. PRP stands for platelet-rich plasma, so this is more of a recent approach to knee osteoarthritis. It's definitely more conservative than total knee replacement surgery because they don't cut you open, and they don't cut the knee open, and they also don't place a whole new artificial joint in your knee. What they do is they try to take out some of your blood essentially, and then centrifuge it, and they mix it up, and so that they can inject it back to the spot that hasn't been healing like it's supposed to, like a joint with osteoarthritis that has a lot of inflammation, to try to heal it faster. It basically is an injection of fluids coming from your body so that you can heal faster. It has a lot of healing factor to it, and that's what platelet-rich plasma is. And then you also have an option to just try at-home care with things like bracing, so that it can give you a little more stability in the joint and take some loading off, putting some heat on there to help relieve some of the muscle spasm around the knee joint and bring blood flow to the area as much as possible. And then you can also try some over-the-counter medication. So these are all your options here. But because I'm a physical therapist, we're going to dive deeper into what we do in physical therapy to help with pain associated with knee osteoarthritis. Now, we're not going to be able to change the structure of the knee in physical therapy. It's not a surgery, right? But we do these 4 things very well, in my opinion, and that has shown great outcomes for patients that come in with knee osteoarthritis in relieving the pain and getting back to what they want to do with less pain. And so the first ground to cover is strength and stability exercises, like we talked about in the previous slide. You want to try to strengthen the muscles around the knee and the hip, because the muscles around the hip and the pelvis itself affects everything down the chain, your knee and the ankle. And so it decreases amount of pressure on the knee and it stabilizes the knee joint better, so that we're not putting too much loading on the knee unnecessarily. So it's important to keep in mind what the patient participates in and what their movements look like when trying to strengthen and stabilize those main joints of your leg. So doing things like squats, single leg stands, and walking all really depends on what they like to do and what they need to be able to do. And so it's crucial to train them and train my patients personally. I train my patients in the most functional way possible. Neuromuscular re-education, this ties back to biomechanical analysis. We want to see first and evaluate how well or how efficient this patient moves. And if they have pain with certain movements, do they have pain because they're not as biomechanically efficient, and so they're loading that knee more than they have to, and so that's what's causing the pain. So this is definitely more of a long-term solution. You may not see any big changes after 2-3 sessions, but you're definitely going to have a guideline or a roadmap to success, like we'll talk about later, when it comes to physical therapy, in my opinion. Patient education, this ties into what I was just saying, goal setting and roadmap to success. We're going to analyze what you do and what kind of movements you participate in when you have the most amount of pain, what makes it better, what makes it worse. We'll monitor your pain, and we'll monitor your strength, your range of motion, things like that, to help set up a foundation for us to build on. And so this also ties into what I was saying earlier. There's so many treatment options, and so if physical therapy really isn't it for you and we don't see the outcome that we want to see, like we agreed on, then hey, maybe this isn't for you, and we tried it and maybe it's time for something else. So then we help you kind of guide, we guide you throughout the process of rehab and your knee osteoarthritis. So that's another great resource that we can be there for, and resource that we can provide. And then also manual therapy. We're not going to totally rely on manual therapy, but I think it does help tremendously with getting more mobility, range of motion, especially in the beginning. If there's any restrictions around the knee, then we can free it up a little bit with some soft tissue work. We can work directly on the knee joint with some traction techniques, distraction techniques, joint mobilization techniques to help with getting the movement better. And so that is how we go about things, very generally speaking, in physical therapy for patients that come in with knee osteoarthritis. Again, it's going to be very specific and tailored to who I'm working with, because knee osteoarthritis is just an underlying condition, and it's a normal part of aging, like I said. And so I hope that helped. I hope that gave you a picture of how to go about things. If you have knee osteoarthritis, it's not the end of the world. You just have to figure out your options and then go from there. So if you have any questions, please let me know in the comment section down below. And thank you for watching.